Are you the parent or caregiver of a toddler? And maybe with good intentions, you've been trying to help your toddler talk more. But you've noticed that every time you try to get your toddler to talk more, maybe you suggest vocabulary, you ask them to repeat after you ask them to say something, your toddler does not repeat. This is a very common problem for parents and caregivers to have, and there are some solid reasons for why this is the case. So I'm going to go over those reasons, and I'm also going to suggest some other alternatives to help your toddler with their speech and language development. But first, a quick introduction. Hi, my name is Amini. I'm a speech and language pathologist with several years of experience working with children and their parents to maximize speech and language development. I also have a practice, Smarter Speech, in the Bay Area where I do the same. And my mission with this channel is to empower parents and caregivers, especially those with children under the age of 5, because this is when a child's language is developing so rapidly. And little things that you do in your daily routines can have huge implications for not just how speech and language develop in the coming years, but also how learning develops as well. So without further ado, let's get into why your toddler is not repeating after you. The number one reason is because toddlers do not do well when they are faced with pressure. So the moment that they realize that you're trying to make them do something, you're probably going to get the opposite effect. So this probably isn't news, especially for those of you who have children who are around 2 years old and they're entering their terrible twos. But unfortunately, this also applies to talking. So if you tell your child to say something, it's very likely that they will not say that at all. So a child's language blossoms and develops when there is no pressure, basically when a child is having fun. That's why a lot of speech therapy is play-based, and there aren't very many demands placed on a toddler. So it's very important to keep that in mind and to tone down the pressure. So make sure that you don't seem like you're expecting something from your child. Don't be talking too much and waiting and telling your child to do things, because likely it will not be successful. So instead, focus more, just 10 to 15 minutes a day, on playing with your child, just establishing that communication, that eye contact, those back and forth turns, and just having a good time. A lot of first words happen just when a child is having a good time and when they want to connect with their parent or caregiver. So that's my first one, tone down the pressure and just play. Just have fun if you need to, because sometimes playing with a toddler requires patience. Just set a timer and play for this 10 to 15 minutes. The second reason that your child might not be repeating the word that you say is because maybe they haven't heard it enough. Hear me out. Whenever you are learning a foreign language, so say you're learning Spanish, right? And if someone asks you to say gracias after a little bit of time, you'll probably say it because you've heard gracias so many times. But if somebody asks you to say zapatos after a few times, you might hesitate a bit because zapatos isn't something that you hear very often. You might worry, am I saying it right? Is that the right way to say it? What kind of shoe is a zapato? All these things will come into your head before you'll want to repeat the word because you just haven't heard it enough. You're not familiar enough with it. Believe it or not, something similar happens with toddlers. So if it's a word that they haven't heard very much or they're not very comfortable with, the chances of them using it spontaneously are pretty low. I mean, they can use it, but it's much more likely that they will use words that they say and hear all the time. That's why first words tend to be things like mama or dada or milk or more, because those are things they just hear over and over again during the year or so, even before they say those words. So what you want to do now that you know this to help your child is to focus on saying certain words, say the words that you really need your child to say, like help, for example, over and over again. So we call this bombardment in speech therapy, but you can just do it informally. So for example, if you want your child to ask for more of something, every time you're pouring more milk in the bottle or you're putting more food on the plate, you can keep saying more. So, oh, time for more milk or more food or more blocks, or more tracks. Every time you pull a track out of a box, you can say more tracks, more tracks, more tracks. Set a timer for 10 or 15 minutes a day and think of a few words you want to teach your child. And all you have to do is slowly and intentionally say those words over and over again. You're building that familiarity. And remember, if you're keeping the pressure way down, your child, when you least expect it, will probably use that word that you've been saying over and over and over again in their presence. My last tip for why your child might not be repeating the word that you're saying is maybe they haven't quite figured out how to say it. So if you've noticed when you're playing with your toddler, you might see them looking at your mouth when you say certain things. This is very intentional. You are their primary speech and language model. So when they're looking at your mouth, they're trying to figure out, at least subconsciously, how you're saying the sound that you're saying. So you want to take advantage of this fact. And for those 10 or 15 minutes a day, at least, that you're playing with your child, you want to get down to their level, eye level, make sure that your face is close enough to their face. So you're on the mat with them, not talking down to them, and take advantage of the fact that they're looking at your mouth by bringing certain objects near your mouth, because chances are that your child will follow your hand to your mouth. So for example, say you want to give your child this train, instead of just giving them the train, you'd say, oh, look at this train or this car. So every time you're going to give them something from this box, you're bringing things up. So your child will notice how it is that you're making the sound. And maybe with time, especially if you're saying it over and over again, and again, you're dialing down that pressure, your child will attempt the way that you're saying car or train. If you do notice that your child seems to be looking at the way that you're saying the sound, but they kind of are groping a little bit with their lips, they're like trying to move them, but they can't figure out how to move their lips, that is something that you want to mention to a speech therapist, maybe schedule an appointment to talk to one, because that does have some implications for speech sound development, and they'll talk to you a little bit more about that. So if you're seeing some groping motion, it is definitely treatable, but that is something that you want to mention to a speech therapist. So last but not least, bringing those objects to your mouth. So those are our 3 reasons why your toddler is not repeating after you and what you can do to help them. Decrease the pressure. So if there's pressure, they will probably not talk. If they're not familiar with something, you want to repeat over and over and over again. Also, if they don't know how to make the sound, you want to make it really obvious how you're saying the sound that you're saying. Bring objects to your mouth, emphasize them, say them nice and slowly, add a popping sound, whatever it is you need to do to bring attention to how you're making your sounds. All right, so I hope that that video was helpful for you. If you continue to be worried about your child's speech or language as a toddler, it's a good idea to reach out to a speech therapist near you sooner than later, because you want to take advantage of the fact that your child's brain is growing so fast right now. So I recommend making that call to a pediatrician or a speech therapist sooner than later. If you're looking for more resources to help your little one, check out the links in the description box below. There's a link to our mailing list where you'll receive a tip every month themed to the month on boosting speech and language for toddlers. There's also a link to our ebook, and there's also a link to our parent education courses and a link to some materials that I've demoed in this video. Thanks so much for watching. I hope that this helped you, and happy talking.